Okay, so she is finished icing, so we're going to go ahead and carefully disconnect her from the ice and compression unit. So it's cold circulating water and compression, and she did that for about 20 to 30 minutes. And now we're ready to switch back over to the brace. So she has been icing on a ramp, not a speed bump. So this was not underneath her knee per se, it was under her calf so that her leg was in full extension. So we're going to take each strap of these 4 straps off, stick them back to themselves. Makes it easier for putting back on. And then hopefully at this point, your family member's able to raise their leg on their own, nice and straight, and you can just pull this out. If not, you would need to give them support under their ankle and calf and lift their leg as you try to remove the ice pack. So at this point, it is okay to touch the leg, give them some sensory feedback. This helps the leg as the block wears off to stop being so tender and sensitive. They can do some ankle pumps, and you can even check for the color, make sure the color on their foot looks good, shouldn't be a dark purple, and make sure they don't have a ton of calf pain. You can check their swelling, run your hands gently over the incisions, and if you want to, if they relax, let your quad relax, you can do some gentle patellar mobs just up and down, but that could be irritating and a little sore over those portals. Now we're ready to get back into the brace so that they're safe. We don't want any side-to-side motion in the knee joint. So again, she's very good at doing her straight leg raise. Not everybody is able to do that. Typically when I put the brace back on, this is that Breg T-scope. You may be in a DonJoy, which is similar but different. We're going to, a lot of times we have them kind of hold it in place. I start with just below the knee, clip and tug, but you want to hold the brace still so you're not actually tugging on the knee. So here I hold the brace snug. That may be sensitive there. You can loosen that after you finish tightening up. And then I go above the knee. So if you pull on these, hold the brace still so you're not tugging on the knee. I'm holding here, snug, lay this flat. Now something I've learned from the factory, there's a different connection. There's just a little alligator Velcro like this, and it goes either on the end of the strap, or sometimes you might need to fold it, rough Velcro, and then this will stick back onto the smooth. What I've done is, this is just cable wrap, so it's rough Velcro, smooth Velcro, and it gives you a lot better flexibility to secure this end and not run into where the plastic is where you can't secure it. So I'm going to go ahead. Again, I held her still when I pulled on that. Loosen. I clip, hold still, tighten, and then lay this flat all the way back against the smooth. Last but not least, I'm going to tighten the ankle. You might feel like you need some cushion in here. A fluffy cabin sock folded over or a washcloth will give them good cushion under their ankle. The brace is going to want to fall down when they're upright, so just go ahead and start it down here at the ankle with some cushion. I'm going to hold the brace, squeeze it tight, tighten the Velcro, and then again raise up and secure the rough Velcro against the smooth. This should be locked straight. This is the safe position to crutch around. Most patients are non-weight bearing if they've had fracture repair or meniscus repair, so she will not be putting weight on this, but if there should be a mishap, the safest position is locked in full extension. We'll talk about drop locking the brace later.